South Carolina is tipping the scales.
That's right. Weigh in as the 7th heaviest state in the country. It's new tonight at 7. 63% of adults in this state are obese, many morbidly so. Their weight is life-threatening.
People in that group have a body mass index of 40 or more. For example, you'd be 5'7" and weigh 255 pounds. Now, these folks have a tough time losing weight, so last month, a test program got underway in South Carolina. The goal, to see if the state health insurance plan should pay for weight loss surgery again.
The controversial program is paying for 100 state workers to have stomach shrinking surgery, and it's costing you, the taxpayer, $2.4 million. Now, 2 local women who are part of the test have agreed for Live 5 News to follow their progress for a year.
And tonight they share their stories with me for the first time.
You have elected to have a laparoscopic gastric bypass, right?
Right.
Tina Wright is an MUSC nurse, but this time she's in the patient seat. She's getting ready for weight loss surgery.
Have you step up on the scale?
The procedure should help her lose half of her body weight. At 34, her ultimate goal:
I hope to have a family someday, and so those kinds of things I think I've missed out on.
Until now, the roughly $30,000 cost stood in Wright's way. The state insurance plan no longer covers this surgery. She applied early and qualified to be one of the 100 state workers in the state-paid test group. Surgeon Dr. Carl Byrne calls it a cost-saving investment for South Carolina.
So I would say that ultimately the state health plan is going to save money by paying for weight loss surgery for these patients with multiple weight-related medical problems.
Paulette Okurowski is another state employee who's part of the test group. It's surgery or her life.
It's to a point where it's affecting my hypertension, my cholesterol, possible diabetes, so I'm looking to have a healthier life.
Paulette, the most important thing that I want you to remember is that you get to see a dietitian every time you come in to see your surgeon.
A dietitian explains how small Okurowski's stomach pouch will be after gastric bypass and describes what she'll be able to eat and drink and how much. About a week later, Okurowski's in the operating room. Dr. Burns says the surgery is only for people with life-threatening obesity. It's not a cure, but rather a tool to help the patients lose weight. If they don't have surgery, he says the morbidly obese patients develop diabetes and high blood pressure and eventually kidney failure.
Well, then they're going to have to go on dialysis, which costs a fortune. Then they're possibly going to get a kidney transplant, which again costs a fortune. And then they're going to have to take immune suppression drugs for their kidney, and that costs a fortune.
Okurowski and Wright feel they were lucky to be part of the state employee test group. There aren't any more openings for Tri-County patients. Both say after years of weight loss programs and putting the weight back on, this time will be different.
The statistics that we have long term, for example, out to 20 years, would indicate that 85 to 90% of those patients will keep at least 55 to 60% of that weight off permanently. So that's pretty good.
To hear what Wright has to say about being part of the state-paid test group and to see full details of what these patients can eat after surgery, head to live5news.com. And an update on Okurowski's weight loss since her surgery 10 days ago. She tells me she's lost 20 pounds. Tonight at 11, meet a Somerville couple who used the money from the sale of their house to pay for weight loss surgery. What else they got in the bargain? Their story tonight.